When you talk about health literacy, we're really talking about the ability to obtain health information needed to make informed decisions about one's health or one's family's health. And I think the major addition to this definition is the idea of numeracy, or the ability to understand printed information or verbal information around things that have numbers in them. And much of the publicly available health and safety information, it's too technical, it's too complex, and is often too vague about recommended actions. And, medication adherence, as we talked before about numeracy, is a big component of that. Following prescription instructions, calculating doses, is a major problem for people in the United States. And the morbidity and mortality associated with poor medication adherence is estimated to cost about $500 billion annually. 20 to 30% of prescriptions are never even filled, and 50% of prescriptions are not taken as prescribed. And oftentimes people look at that as the patient is non-compliant, but they don't really look at whether or not the person actually understood what they were supposed to do and why they were supposed to do it. It's hard to really assess the adequate ability to follow these type of written or verbal instructions. And then also meets the needs of populations with a range of health literacy skills while avoiding stigmatization. Other attributes are using health literacy strategies in interpersonal communication and confirming understanding at all points of contact, providing easy access to health information and services and navigation assistance. So these are just some of the basic strategies, using common words, no jargon, focusing on a limited number of messages, using simple visuals to make content more easily understood, using short sentences written in the active voice, and allowing users to hear words clearly. And that's for audio. Using boxes that provide a don't know option, so that individuals don't feel compelled to check inaccurate information. Breaking the information into manageable chunks, clearly labeling each section and sequencing them in a logical order, and trying to avoid calculations whenever possible, and communicate clearly what specific action steps to take. Again, breaking them into manageable steps. So there's some common readability assessment tools. And again, without reading through all these, the important thing to realize is that there's actually the Flesch-Kincaid grade level, which is actually available for free in Microsoft Word, so that any employer who uses Microsoft Word to provide literature can do this assessment. Now, it's designed for English text only, and most of these are for English, although the ARI is also Western European languages. But, it really is good for companies to start to begin to think about whether all their documents are readable to their employees. And again, the ones that are most affected, are the ones that have low education, or at the bottom end of the wage earning scale, and are at greater risk for chronic diseases. And in this day of TikTok and Facebook, the YouTube, the realization is that people actually are more likely to go to these sources for their medical information, because the current health system relies on a communication approach where the recommendations are typically disseminated by institutional websites and clinician-patient interactions, both of which are way, way above most people's education level.